Hello, this is your host from the channel. One of the most common concerns that we hear about when people call up their vet for an appointment or email us is, my cat's not acting like themselves. They're really lethargic. And today we're going to talk about exactly what we mean when we say that. When are we concerned about it? What are some of the causes? Most importantly, what should you do if your cat is presenting with lethargy? There's two important things to think about when discussing lethargy. One is duration. How long has this been going on for? The other is the severity. How severely lethargic is your cat? When we use the word lethargic, what we mean is that there's decreased activity. It can be decreased appetite, decreased water intake, and they might just be sleeping more than usual. In general, if your cat has had this decreased activity for less than 24 hours, it's probably not something that you need to be too worried about. Unless your cat is severely lethargic, in which case, please call your vet and let them know what's going on. But typically, if it's been less than 24 hours, you can watch it and see if it goes away on its own. Now, if it continues beyond 24 hours, then you definitely need to contact your vet, because it could be something that is more serious. Lethargy can be a sign of many different diseases, so it is very important that we take a deep dive into history and do a thorough physical exam to try and figure out what is causing it. Some of the common causes of lethargy are things like GI upset. Maybe they've ingested something that they shouldn't have, or they could be having pain. That pain may be coming from the GI tract, or it could be coming from another part of the body. This could also be due to kidney disease, liver disease, hyperthyroidism, where the thyroid is working too fast. It could be due to an infection, either bacterial or viral, or even parasites. If the blood work doesn't show anything else, and the physical exam doesn't reveal anything else, then it could just be because they're getting up in age. It's just like people get slower as they get older. Cats do too. So the first thing that you want to do if your cat is lethargic is make sure they have access to fresh water. Sometimes when cats get dehydrated, they will become lethargic, so you want to make sure that that is not the problem. You also want to try and tempt them to eat. Usually a little bit of wet food, some smelly wet food, will do the trick. But if they still don't want to eat, then I would recommend giving them some fluids subcutaneously. This is something that we often recommend to our clients when they come in for a recheck after a dental procedure or a surgery. We'll tell them to monitor for lethargy and give fluids at home if necessary. Fluids given at home are really easy. They're usually in the form of a liquid that you can draw up into a syringe and just slowly give them in the back of the mouth. This way, if they can't swallow, it will prevent them from aspirating. It'll go down the windpipe and into the stomach. If you're worried about them aspirating, you can always turn them sideways and support their head and neck and lift their head up so that the fluid will go into the stomach rather than into the trachea or the lungs. Other things you can do at home to help your kitty if they re-lethargic is make sure they have a clean litter box. Sometimes cats won't use the litter box if they're not feeling well. Make sure that you have a clean box. Scoop it daily. Make sure it's in a quiet area. It's not near their food. Those are all things that will help your cat stay a little bit more comfortable. If you're noticing that your cat's lethargy is associated with vomiting or diarrhea, you can try putting them on a bland diet. A bland diet consists of boiled chicken and rice, plain boiled chicken, no seasonings or salt, and just plain white rice. These are both easily digestible protein and carbohydrates, and often what we all recommend to our patients for GI upset. If you notice that your cat's gums are pale or white, then this means that they're anemic. So it could be a sign of anemia. If it's really pale, then I would highly recommend contacting your vet right away and asking for an emergency appointment. Another thing you want to look for is a fever. A normal temperature for a cat is 100.5 to 102.5. Anything above that could be dealing with an infection. Now, sometimes cats will have a fever, but they'll be so lethargic that they whoa and be able to get up to a normal temperature. So you can't always take a temperature rectally. Sometimes you have to go in the mouth or in the ear. And if they're really, really lethargic, they may not be able to hold the thermometer in there long enough to get an accurate reading. Other things you want to look for are changes in urination. Are they urinating more frequently? Are they having accidents outside the litter box? Are they straining to urinate? All of these could be signs of a lower urinary tract infection. Now, the next step, after making sure that their environment is safe and they have food and water available, is doing a physical exam. When you do a physical exam on a patient, there's several different parameters that you want to check. The first one is the mucous membranes. The gums are the easiest place to look. If they're white or pale, like we talked about earlier, that could be a sign of anemia or that they're really dehydrated. If they're jaundiced, this could be a sign of liver disease. If they're red or pink, that's a good sign. That means that you're nice and healthy. You also want to check the heart rate. Normal resting heart rate for a cat is between 140 and 220 beats per minute. Anything less than that could be bradycardia or a slow heart rate, and anything more than that could be tachycardia or a fast heart rate. The next thing you want to check is the respiratory rate. So this is how many breaths is your cat taking per minute. Normal is between 10 and 30. Any more than that could be something called tachypnea. The next thing that you want to check is the hydration status. There's several different ways that you can do this. You can do a skin tent test where you just pinch up a little bit of skin and let it go. If it goes right back, they're probably pretty well hydrated. But if it stays up there intense for a little while before it goes back down, then they could be dehydrated. Another way to check for this is to feel the gums. The gums should be tacky. Shouldn't be any excess fluid, but they shouldn't be dry either. You also want to check the temperature. Normal temperature for a cat is 100.5 to 102.5 degrees Fahrenheit. The last thing that you want to do is check the fecal quality if they've had any diarrhea recently. Is it soft? Is it formed? Because this can also help us determine if they're dehydrated. If your cat is lethargic and you notice that they have sunken eyes, you should seek veterinary care immediately. Sunken eyes can be a sign of severe dehydration, and it can be life-threatening. I just mentioned a few of the things that we would check when we do a physical exam. But if your cat is lethargic, we're going to do a lot more than that. We're going to check the abdomen. Is there any distension? You feel any pain when I press on it? We're going to listen to the lungs. Are there any abnormalities? We're going to listen to the heart. Is there a heart murmur? We're going to check the lymph nodes. Are there any enlarged lymph nodes? Because that can be a sign of infection. We'll do a complete blood count. We'll do blood chemistry, a urinalysis, and depending on what we find, we may do x-rays or ultrasounds or even exploratory surgeries. It's impossible to say how much your visit to the vet is going to cost without knowing what tests are going to be necessary. But in general, we can expect that it's going to cost a minimum of $100 for a basic workup, but it can go up from there. I hope this helps. Please let us know if you have any questions. Like the video, subscribe to the channel so you don't miss any of our future videos. Thank you so much for watching.